Lifestyle changes in migraine. Migraine is a very common type of headache which is throbbing or pulsing in nature, and it is usually associated with nausea, vomiting, and extreme sensitivity to light and sound. In many cases, it is one-sided headache. Globally, around 14 to 15% of population is affected by the migraine, and it is a major cause of disability. So, we will discuss about the suggestions, the lifestyle changes which can help in reducing migraine frequency as well as severity. So first suggestion is getting regular exercise. Usually in migraine, the headache is aggravated by physical activity, but regular exercise may reduce migraine frequency. How it helps? So it is proposed that exercise induces increase of levels of certain chemicals in our blood, which help in reducing the migraine frequency. These chemicals are like beta endorphin, endocannabinoid, and brain-derived neurotrophic factor. Exercise can help directly by reducing migraine frequency by increasing the level of these chemicals, and it also helps indirectly because of its role in weight management, stress reduction, and improving sleep. As we go through the slides, we will see that these three are the other important factors for reducing the migraine frequency. So try to do 30 minutes of moderate intensity exercise on most days of the week. Exercise tips for people with migraine. First, choose an activity you like so that you stick to it. For example, walking, jogging, swimming, or cycling. Second is build your stamina gradually. In terms of aerobic exercise, start with walking. Later on, you can gradually work up to higher intensity exercise. Third thing is snack smart to keep blood sugar in a healthy range. The American Migraine Foundation recommends eating about 90 minutes before you exercise, and it suggests to have protein rich foods such as eggs, sprouts, or nuts prior to exercise. If suppose you get cramps, then you may have eaten too close to your workout, and if you go too long without eating, it can also trigger a migraine. Fourth thing is stay hydrated before, during, and after a workout. It has been proven that people with migraine who drank more water had less intense headaches. Fifth is warm up and cool down. Rather than jumping right into your routine without warming up first could trigger a migraine. So try taking a 5-minute walk before you start aerobic exercises. If you are doing resistance training, try warming up with some light weights first. After your workout, take a 5-minute walk or do gentle stretches to help lower your heart rate and blood pressure. This also helps to eliminate some of the post exercise muscle soreness that comes with resistance training. Next is keep cool during exercise. If you're overheated, it can trigger a migraine. So, heat, humidity, bright artificial lights in the exercise studio, and bright sunlight can all make a migraine more likely. So, try to exercise in the early morning. Use correct posture when exercising. Also, try exercise or physical activity that is not aerobic, for example, hatha yoga. It is particularly efficacious for someone with migraine because it actually works on some of the mechanisms we see in migraine patients, such as neck pain and stiffness, anxiety, catastrophizing about pain, and stress reduction. And you should also talk to your doctor about your migraine medication because certain medications affect your heart rate and blood pressure during the exercise. Next is maintaining a healthy weight. So, obesity is a risk factor for migraine. So, if you're obese, there are higher chances of getting it, and the severity will be higher and duration will also be more. So, losing weight gradually and safely under the supervision of a doctor or registered dietitian can help to reduce the migraine frequency. So, things you must know about body weight and migraine, the relation between the two. So, migraine risk associated with obesity may change with age. So, there was a study published in Headache Journal which found that having obesity, that is body mass index of 30 or higher. So, let me first tell what is body mass index. Body mass index is weight in kilogram divided by height in meter square. So, anyone having obesity, it increased the prevalence and odds of migraine in men and women of the age 20 to 55 years, but after 55 years, it had no effect on the risk of getting migraine. So, and but also at the same time, people who are underweight, that is BMI less than 18.5, they also appear to be at a higher risk for migraine. Having obesity increases your risk for progression from episodic to chronic migraine. And there is a research that suggests that having both obesity and a gastrointestinal disorder like irritable bowel syndrome increases the likelihood of migraine. Some weight loss methods may make your migraine worse. For example, intermittent fasting. So, in intermittent fasting, usually people eat only 2 times in a day, and there is a long gap between two meals, which is around 15 to 16 hours. So, not having food for such a long hour sometimes may cause a dip in your sugar level, which can trigger a migraine. So, try to avoid such methods of weight loss. Second thing is, many a times people reduce sugar intake for the weight loss, but they replace it with an artificial sweetener such as aspartame, which may be counterproductive, as in certain patients, aspartame also triggers the migraine attack. So, the best would be to have small, sustainable changes to your eating habits, which are often more effective than drastic diets. So, maintain a healthy diet with plenty of fruits, vegetables, and whole grains. Eat regular meals and snacks to stabilize blood sugar levels. So, third important point is getting enough sleep. 7 to 8 hours at night for adults and 8 to 10 hours for teenagers is very good and optimal. Try to stick to a regular sleep schedule. So, some tips for a good sleep are: when possible, try to go to bed and get up at about the same time each day. So, some bedtime rituals such as taking a warm bath, reading, listening to calming music, doing yoga, or praying can help you to fall asleep. Second thing is to create a sleep environment that is dark, quiet, cool, and comfortable. Avoid electronic devices at least 1 hour before bedtime due to their impact on the circadian rhythm. Circadian rhythm is your body's natural sleep wake clock, and it is affected by the blue light emitted from the smartphones, iPads, etc. Avoid caffeine, alcohol, and heavy meals close to bedtime. Here, I would like to talk a little more about alcohol. So many times, patients who come with migraine, they say that after drinking alcohol, they fall asleep very nicely. It's true. You do fall asleep a bit early because it's a sedative. But the problem is after 6 to 7 hours, when its effect is withdrawn, many times people wake up with a very bad headache. Second thing is, it affects your sleep architecture. So there are two types of sleep: non-REM and REM. REM means rapid eye movement, which is a very important part of sleep. So it delays the first REM period and increases the REM sleep during the mornings, which is not good. And you should not have heavy meals close to bedtime because it makes you very prone for gastroesophageal reflux. That is, all the stomach content, food and acid, all comes to your food pipe and throat, which causes irritation, and you suddenly wake up from the sleep. Try to practice relaxation techniques such as yoga nidra before sleep. There are many videos of yoga nidra on YouTube. Okay, and the last point is, if you're having some sleeping problem, it doesn't mean that you should start taking sleeping pills. Always consult your doctor before taking sleeping pills. And so now we have discussed what all changes you have to make in your lifestyle. Now we'll discuss about the triggers. What are the common triggers and how to avoid them? So, identifying and avoiding migraine triggers is essential for migraine management. So, here are some common triggers. First one is hormonal changes, especially the fluctuations in estrogen. So many times ladies have migraine attacks just before the periods, their menstrual cycles, and also during perimenopausal period, they have increased frequency of migraine headaches. Some other things which can trigger it, like hormonal medications such as oral contraceptives and hormone replacement therapy, they also can worsen migraine. Second is certain drinks like alcohol, as we discussed now, especially wine, too much caffeine, such as coffee, tea, they can also trigger it. Third thing is stress. Perhaps it is the most important, biggest culprit of all, which accounts for almost 70% of all triggers. So, how to cope with it? So, biofeedback, relaxation, therapy, meditation, exercise, maintaining a consistent sleep schedule, which we just discussed now, they all help in managing stress. Fourth is sensory stimuli, as we had discussed earlier also. So, bright or flashing lights, sunlight, loud sounds, strong smells such as perfume, paint thinner, second-hand smoke, and they all can trigger migraine in some people. So, if suppose you have to go out in sunlight, carry an umbrella and cover your head. Before leaving your house, drink plenty of water. Fourth is sleep disturbances. Both insufficient as well as excessive sleep can provoke migraines. Next is physical factors like intense physical exertion and weather changes, barometric pressure, high humidity, heat, they all can trigger migraines. Certain medications, as we discussed, oral contraceptive pills and vasodilators, which are used for high blood pressure, they also may aggravate migraines. Certain dietary triggers, some of which we have discussed, and some are histamine and monosodium glutamate, which is usually found in the outside food, chocolate, dairy products, artificial sweeteners, caffeine, and skipping meals. They all can provoke migraine. Smoking. So, smoking, if you smoke, quitting it can help reduce your migraine risk. And if you are consuming alcohol, limit it to moderate levels. Ideally, it should not be more than 90 ml. So, this is all that I wanted to tell you about the tips and suggestions. If you have any other trigger or any other question that you want to ask, you can put it in the comment box. Thank you.